yourself, Kevin.
All right, thanks, Zoe. Hi, everybody. I'm Kevin Schulman. I'm faculty director for the Masters of Science in Clinical Informatics program here at Stanford. And thanks for joining us this evening. Zoe Richardson, who's our program manager, and we'll walk you through a little bit about the program, why we created the program, what our goals are for people coming to the program and graduating from the program, and about the application process, and then answer some of your questions. At any time, if you have questions, please put them in the chat. Zoe's monitoring the chat while I'm talking, and she'll be able to answer your questions. So this is an exciting time for us. Happy New Year to you all. This is the beginning of our round 2 for our inaugural class. We've gotten a great reception so far, so we're incredibly excited about really what the student experience is going to be like in the classroom, and we'll talk more about that. So, like I said, oops. Of course, my thing doesn't want to share. Let me try again. Nothing like a technology program where we have trouble with technology. Always works that way.
Do you want me to take over?
Yeah, let's see if you can get yours. My PowerPoint's frozen. Great. So as I said, I'm by background, I'm a professor of medicine here at Stanford. I'm at the Clinical Excellence Research Center in the medical school, and I'm a professor of economics at the Graduate School of Business. Been at Stanford for 2.5 years. Before that, I was at Duke for 19 years, both at the medical school, the business school, and ran a similar program at Duke. Zoe's been great to work with. She's our program manager, really worked with me through the entire process of university review and to get the program launched and off the ground. And just announced today that she's taking her birthday weekend off in a couple weeks, so well deserved. So thanks, Zoe. So as I said, Zoe's monitoring the chat feature and can help you if you have any questions. I want to start with is kind of why MCiM, and really kind of go back a decade ago now when President Obama signed what we call what was called the High Tech Act at the time. And it's hard to remember, but before 2009, the doctors, when we did our charts, were on paper or maybe on a homegrown electronic health record system. And what the federal government did over the last decade is invest $38 billion into infrastructure for doctors and hospitals to move into a world of electronic health records. And President Obama in his signing statement said that we wanted to use health information technology to connect doctors and patients for more complete and accurate health records, which actually we've done. Tools like electronic health records and electronic prescriptions can help doctors and patients make safer, smarter decisions about healthcare. This is all about clinical decision support, and this is still an aspiration. And in fact, today, in the care of COVID patients, we're trying to ask the question, Stanford's now taking care of 1,000 patients with COVID. What did we learn about what treatment patterns are the most important in caring for these patients? And better technology can cut costs for providers by reducing paperwork and duplicative tests. And unfortunately, there's pretty good evidence that that's not the case, that we haven't seen any of those benefits in healthcare. We had a nice paper in JAMA a couple of years ago where one of my students actually did a TDABC, a cost accounting study of the cost to submit for physicians to submit a bill, and hadn't changed at all from before electronic health record systems. And actually with some of the other faculty members here at Stanford and from MCiM. We just had a paper in the American Journal JAMA Internal Medicine that showed how the United States is actually using technology compared to everyone else in the world that has a similar electronic health record vendor. And we're forcing physicians to do a lot more paperwork now, I guess, electronic typing than other people. So this is a real dilemma. Here is the aspiration for what we thought technology could do for us in healthcare. We all got very excited by this vision, as did the president, as did the Congress, but that's not what we've seen. And so the big question is why, and what can we do about it? Zoe? So, you know, from my perspective, sitting at the medical school and the business school, this is a huge challenge to the business models around information technology and healthcare, and a need to really dramatically change the way we think about the world of digital and how that integrates into service delivery. And MCiM has been a really exciting place to kind of push these concepts forward. So medicine needs a targeted, intensive approach to knowledge and skills not widely taught in terms of how to shape organizations and how to take advantage of our evolving digital landscape. And we've seen some of that with COVID. We've seen this huge migration from in-person visits to digital visits, but we still haven't seen this full digital evolution where you get on your smartphone and get access to clinical services in real time. Next slide. So MCiM's a full Stanford graduate degree. It's an intense but achievable academic experience with a pretty flexible format designed in particular for working professionals, but it's not exclusively for working professionals. The curriculum blends business disciplines with data and health technology and ethics. And I'll walk through each of these going forward to show you what the curriculum is. All of the courses that are in the program are specialized for MCiM. They're only MCiM students will be in the class. So there's 6 business courses throughout the program, 6 technology courses throughout the program, and a required ethics course that wraps around for the entire year. And this has been a really interesting opportunity to reflect on some of the challenges that we're seeing with technology all around us, and think about how the business model and social impacts are occurring in real time. So MCiM is a degree for working professionals with alternating weekend on-campus classes. We start next June, and we're hoping that we'll be on campus by then. For working professionals, it's a full master's degree. It's just scheduled every other weekend, so busy consultants or clinicians can participate in the program, or people in other walks. It's a pretty unique curriculum, and it was really fun to put this together, to bring together faculty with expertise in medicine, business, and technology, all in one place. And when we had faculty meetings to talk about what we're going to teach and how we're going to teach it, it's really just the energy that we get just talking to each other about how we bring together these very disparate concepts is really fun. We're building and fostering an interdisciplinary network of faculty, affiliated centers, and students. I'll talk more about that in a minute. All the topics we address, whether they're business topics or technology topics, we're looking at them from a management perspective. And we want to provide students the tools to apply the technologies to achieve the triple aim in healthcare, but we don't expect that graduates of this program are going to be technologists. We expect that they're going to be managers, facilitators, communicators that are going to be able to understand what the opportunity is for technology and build business cases around that. We hope to develop a cadre of leaders prepared to address urgent healthcare and technology challenges. And every week as we get through further and further into this COVID pandemic, we see more and more of these issues in terms of how do we use technology to address healthcare disparities? How do we use technology to improve the health of all of us? How do we use technology to provide healthcare services so that you don't have to come in and have a risk of being exposed to COVID from a healthcare setting? And these days, how do we use technology to help us roll out the vaccine? Where's the data? Where's the list of people who should get the vaccine first. So these are all huge technology issues, but they all highlight the need for a program like MCiM. So in terms of the curriculum, there are 4 quarters. Stanford's on the quarter system, and I'll run through each of the quarters and what the schedule will look like. And again, if there are any questions, please put them in the chat for Zoe. Ask her the really tough questions, and if you have any really easy ones, Zoe will let me know. So, so in terms of the curriculum for the first quarter, we start with accounting for managers and entrepreneurs, and this is an accounting class. We're going to really cover a lot in this course, both financial and managerial accounting, and we may get as far as cost accounting. We're doing some really interesting work right now that might be a case study in this class, where we're looking at the cost of cataract surgery in Arvind Eye Hospital in India, until Ganga Eye Hospital in Kathmandu, Nepal, and 2 hospitals, and inpatient and outpatient hospitals in the United States. So this is a course, it's being taught by the engineering school. So it's really, how do we think about accounting as a tool, again, for managers and entrepreneurs. So if you work in a big organization, or if you start up a company, how do you want to think about reporting revenues? Stanford's got one of our major schools here at Stanford is the design school, and the med school piece of that is a course program called biodesign. And we're really grateful that be able to work with the biodesign program to put together a 1-semester survey course on design ideas about health information technology. This is a really unique class that takes all the concepts of the biodesign, putting the patient first or the customer first, and then thinking about how to build technology solutions for them. Biodesign has been incredibly successful in terms of medical device and the number of companies that have come out of that program. And then leading and managing in healthcare organizations is our core management course, thinking about how do we work in teams, how do we work effectively, how do we work in the middle of crises like we're at today. And then, like I said, we're going to have a bioethics course, the bioethical challenges of new technology, that's going to wrap around through the entire year. And so you'll have that class as a seminar once a month while these other courses are going. So that's the first quarter. The second quarter, we start with principles of strategy, kind of a core business course. And we're excited, actually, we have our head of networks and chief financial officer of the hospital at Stanford are actually going to both come together and teach this class. The head of our vice president of networks actually spent 20 years in consulting for LEK, has always wanted to teach. And so not only are we going to get the principles of strategy plus the perspective both of consulting, strategy from consulting perspective and organizational perspective, but we'll get some real applications to settings such as Stanford. Corporate financial analysis, again, is a program that's a pretty unique finance class. So finance is all about how do we think about investments and cash flows. And this course is going to extend that to think about raising money, especially here in the Bay Area. How do you want to think about, again, making presentation and pitches? And then how do you do, not the accounting of your books, but how do we think about metrics for things like board meetings for startups? Clinical Informatics Strategy is my class. And this is a course I've been teaching for many years and teach right now at the business school. This class really focuses on that core question. Why is it that the technology that we paid $38 billion for didn't achieve the goals that we had for it? We go through kind of a lot of different ideas about business models and structures, economic structures, and then look at a whole series of case studies to think about healthcare applications of technology. We do cases from both the US and actually we have 2 cases from Kenya, which are great. And in the course now, we have cases on Facebook, Apple, Alphabet through Verily, and Amazon looking at Alexa. Zoe. Quarter three, we start with a course called Marketing Science and Patient Engagement. The person who taught this course with me, for me at Duke University, and I just wrote a paper in the New England Journal of Medicine. It came out last week, thinking about marketing applications to the rollout of the vaccines for COVID-19 and the importance of thinking about marketing science in this public health endeavor. That paper has been really well received, but it really makes the case that there's this huge intersection now between marketing and medicine, and that where that intersection is occurring is actually in the digital realm. Because when you think about how do we vaccinate the population of Santa Clara, all of a sudden we go from me being a physician to care for 2,000 people to all of us being in charge of vaccinating 2 million people. And that's a very different set of skills and challenges. So this is a really exciting class. Here at Stanford, this course is going to be put on by the faculty member teaches our core marketing course at the GSB. Healthcare Operations Management is another really exciting course. Dave Shanker over at sits at the medical school and the engineering school, and engineering sciences and management. His work is a lot of applications of machine learning to healthcare environments from an operations perspective. How do we use technology to really look at things like queuing, efficiency? Dave and I have been doing a lot of work in terms of building models for things like we built models for LA County about how to do testing for kids, for school children, so that they could reopen safely if the COVID infection rate comes down. Modeling, we're actually work right now, or some other work we've done is modeling different features of private health insurance to understand how features such as the number of plans in the market and the number and the complexity of contracts for each of the health plans drives up administrative costs. Really kind of fascinating work. He's also using machine learning for patients with type 1 diabetes to try and improve the efficiency of care using real-time feedback from glucose sensors to build algorithms that help identify the patients at highest need for human intervention. Data-driven medicine is a course put on by Nigam Shah. Nigam's one of our top machine learning people here at Stanford, data science people here at Stanford, who's really going to talk about a lot of ideas about how do you think about data science and machine learning applications in healthcare. Social Entrepreneurship and Innovation Lab is Gordon Bloom is our professor for that. This is a really, this is the capstone practicum project for the program, and it spans quarter three, quarter four, it actually will probably start in quarter two, where you're gonna have to think about what your practicum project's gonna be and identify a topic. There's a little bit of time in quarter three to really flesh out those ideas, and then a little bit more time in quarter four to finish up. If you're doing, this is a project you bring to the class, if you're a physician or a fellow, and this could be your research project that you're working on for your fellowship. If you're working in a corporate environment, this course is designed to help your managers understand all your new skill sets and applications of your skill sets to the work environment. Or if you're trying to do career switches or job switches, this course is an opportunity for you to explore something new. So people have done lots of different things with practicum. And then finally, quarter four, we have wrap up our pedagogy, our program. Modeling biomedical data systems is a core informatics course where we look at data architectures. How do we store data? How do we think about things like medical ontologies? And so this is a very traditional health informatics class that really gives you some insight into kind of the complexity of the core data models and the different kinds of data that we're looking at in healthcare. Quality and safety in US healthcare is a data visualization class and a statistics class. And so here it's a reverse classroom kind of experience. where we're going to look at statistics or understand statistics actually through practical applications. In this case, practical applications are actual reports that people get in healthcare or reports that we've seen published. So when you see a patient satisfaction report, we can understand how do you interpret that in the context of something called a ceiling effect, where they, scores are so high that there's really not much room for improvement. And how do you understand that? How do I deal with that as a manager? Both, do I want to actually make any operational changes based on some of these scores? So this is a really important class. We get lots of data and lots of feedback in healthcare. Most of it's noise, very little of it is actual information. This class is going to help you sort that out and ask questions. So like I said, a really exciting curriculum. And the faculty that we're bringing together this really are unique and span the gamut. We'll show you the different centers here at Stanford. As you look at this curriculum and think about the topics themselves are really exciting, totally applicable to everything that's going on around us in the world of healthcare right now. But I would also say a couple of things about the classes. One, and this is the feedback we've gotten over the years, you're going to learn something in class on the weekend and apply it back on work on Monday. So the faculty are here to give you tools and concepts that you can bring back to work in the work environment. And we want this to be totally actionable. This is not a theory course. This is a practical program for managers. The second thing is, it's really important to think about both the faculty, and we have this amazing faculty brought together for this program, but also think about you in the classroom and your opportunity to learn from each other. And so, Stanford really gives us an opportunity to bring together a really unique set of people for the classroom and for this program. And it's Zoe and I's job to kind of tease through the people that have applied to the program to put together the best cohort that we possibly can, with the idea that we want you to be in an environment where you're going to learn from each other. So there's going to be clinical people in the classroom, physicians in the classroom. There'll be non-clinical people in terms of technology folk in the classroom or business folk in the classroom. And then you will actually be on teams where you have to work across all those disciplines. And the program specifically designed to give you that opportunity. Zoe, next one. So here's some of the different programs that we've partnered with to pull this program off. The program sits in the Department of Medicine here at Stanford, but really touches a lot of different programs related to data science around the university. I talked about some of these, MS&E in the engineering school, the biodesign program, our SURF systems operations program, our bioinformatics research center, biomedical research center, and our Department of Biomedical Data Sciences. Next slide. So, why do a master's program? What are you going to get out of a program? So the first is that I got a direct message. Ash, do you want to send that to Zoe instead of me, and she can answer it? But I just saw it for a second. The question is, do you have to be a manager to be in this program? The answer is no. And that kind of relates to this first issue, that we want people who really want a greater understanding of the operational, clinical, and ethical complexities, leader spaces they seek to optimize technology and innovative solutions. And so we want people with management skills or with aspirations for management positions. We want to build management skills to lead multidisciplinary teams. Healthcare is a really complex environment these days. And so how do I lead people with very different backgrounds, especially operationally, people that are really stressed? And so what are the skills that I can learn about how to talk across these different boundaries and how to talk to people in these different organizations? Data is so important to our success going forward in technology. And so how do we learn to strategically leverage these things in a variety of different clinical settings, whether it's an existing business like Stanford Healthcare or in a startup or a NewCo down the street. Like I said, we want you to be in a position to immediately apply what you've learned in class to help you advance your career. The reason why you do a master's program, part of it's to learn and part of it's to help you accelerate your progress as you move forward. And our invitation is out to get you to join an exceptionally accomplished and diverse group of professionals and thought leaders in medicine, business, and technology. And I can tell you from having run this program for many years before I came to Stanford, it really is the energy in the classroom, the collaboration, the friendships that are made in the classroom, the collaborations that are built, friendships that are built are really special. Next slide. So MCiM's open to individuals from a variety of technological backgrounds and business backgrounds. And again, it's not an expectation that you actually have any background in any of the courses that we talked about. The faculty know that you're coming into this pretty much cold. Some people will have some good set of technology, some exposure to technology, no exposure to management. Some will have some exposure to management, no exposure to technology. Some will come from a clinical background, have no exposure to either. We aim to build a student body that brings together a diverse set of perspectives and experiences to the cohort. And MCiM students are proven or emerging leaders with a desire to transform healthcare through the power of technology and technology innovation. So our goal is to cast a wide net and bring together people in the classroom who can share their perspectives with each other, with the faculty. In a graduate program such as this, the idea is that you learn half from the faculty and half from the students in the class. Faculty, again, we already know who they are and what they can bring to you. And it's our job to put together the student body that really can resonate. So this is challenging times all around the world and here in the United States. And as we developed this program, we got pretty strong feedback from the School of Medicine to make sure that since we were touching 3 fields where women and minority groups have been underrepresented in leadership roles in technology, informatics, and in clinical medicine, that in fact we do something with the program to address this. And actually, we've been very successful in that so far. And so our interest is actually making sure we have diversity and inclusion in the classroom and diversity and inclusion in terms of future leaders out there in the marketplace. So MCiM is expected to be a professionally, demographically, and culturally diverse cohort. Students will be at different stages of their lives and careers. And we think that's going to bring depth to learning experience and skills, especially communication skills. So you're going to, we want people that are just graduating college that think through about the world through testing and texting and Snap and all these other things that I don't use that my kids use all the time, and they won't let me use them. All the way to people, we've had people come through the program that literally were Luddites. They couldn't figure out how to turn on their computer. And so that's a kind of diversity we want so that we can learn how to work with each other. But again, this idea about women and underrepresented minorities are also a strong passion of ours to make sure that this program does something meaningful to address these issues. So the application itself is available at the Stanford Graduate Application Admissions Portal. And what we're looking for in reviewing the applications, we have a kind of a robust, holistic admissions process where we welcome people with a diverse range of experiences and backgrounds. People have to demonstrate their academic readiness for rigorous intellectual experience. This is a tough program in terms of the amount of material you're going to cover in a short period of time, as well as their topical interest in this exceptional program. But in fact, if you have a weakness in one area and a strength in another area, our admissions process is to look at everybody, to read all the applications, to all the letters, and to make a decision about your ability to contribute in the classroom. The required materials are transcripts. We gave you a couple of essays, your CV, your statement of purpose, 3 letters of recommendation. If you're coming from outside the United States and don't speak English as a native language, or TOEFL score is required for the Stanford admissions process. And there is an application fee. Stanford will waive the fees in special circumstances. So the application process, actually, like I said, we've been through 1 round of admissions now. It works pretty well. If you have questions as you go through this, Zoe's always available, except for the weekend. She's celebrating her birthday. The MCiM website really, we've been constructed that this summer, have a lot of detailed information about application requirements and the application process, deadlines, and this, like I said, this worked pretty well. We didn't have too many glitches as people went through, which is great for a new piece of software. So it's been well tested by the time you all get to this stage of the process. So we opened December 15th, we opened round 2 applications. Round 2 closes February 23rd. And the students start their first quarter in June 21st, 2021, Stanford's summer quarter. And here's information about our inquiry address and our website. Really, the website's got a lot of information that we're a new program, and we wanted to get a lot of the basic information out there for you to answer your questions. But again, we're here to answer your questions as well. Next slide. And you can subscribe to our mailing list to stay in our loop about MCiM, and just take a picture of this QR code, and that'll give you instructions. Lloyd Miners, our Dean of the School of Medicine, and really has been a strong supporter of our program, as well as Bob Harrington, the Chair of Medicine. So just a quote from Lloyd, our Dean. With its innovative curriculum and format, MCiM will provide students with the skills, knowledge, and insights to bring together technology and the clinical enterprise in entirely new ways. COVID has really highlighted the need for diverse digital applications in healthcare, so launch of the program couldn't be timelier. I got another question coming to me about class size and acceptance rate. The acceptance rate, we haven't completed our first year yet, so we don't know that. This is going to be, like I said, it's a Stanford master's program, so it's competitive, and very competitive, I should say. And the typical class size in the first year, it's going to be 25 students, and then it'll grow a little bit over time. I should say this is a permanent degree of Stanford. Some of you might be hearing about this for the first time and be looking for a program for next year. Some people are already looking at programs for the following year. So this is a permanent program of Stanford University. And this year's cohort, the inaugural cohort, is limited by the provost to 25. And then we'll see what happens after that. So career and placement opportunities, these are all great questions. Yeah, you could direct your questions to, instead of to me, to Zoe or to everybody. Feel free to do that. But do we do the med careers? Zoe, do we have a slide on that?
I'm sorry, what? The med careers?
Yeah.
I am not sure. I'll make a note that we discuss it after we get through the submitted Q&A. Okay.
We'll come back to that. We actually have a really robust career placement program behind all this. So what's the time commitment? These are the questions that we've already received in advance. So we'll make sure we get through all of those. So what's the time commitment of the program? It's a rigorous full-time master's program. The total class time, seats in class time, is the same as the traditional in-person courses, but it's been allocated in alignment with the weekend format. So like I said, you're here every other Friday, Saturday, and those are pretty full days from 8 in the morning to 5 or 6 at night, and then some team meetings afterwards. But every other weekend. You'll have online and group assignments during the week. So we have group projects, homework assignments, and those are going to occur in between class weekends. So not you have your work that you're going to do in preparation for class and your work in class. For example, in my class, I have a required practicum project, of building a business plan for a killer app, and it's team-based. So usually there's 3 or 4 people on a team working on that project for the semester. On-campus sessions will allow networking between the cohort. Really, we hope build strong relations with the faculty and offers lots of different professional development experiences that will both be in the classroom, and then we'll have all kinds of ideas about mentoring programs that we're building and other career services experiences. And in terms of building relations, I just talked tonight to one of my students I got an email today from a student from 6 years ago. I had a Zoom call with a student from about 15 years ago, and an email from another student from about 15 years ago. And so, when you're in a program like this, an intense program like this, you're really building lots of new relationships that will carry forward throughout your career. Do you offer admissions deferrals? Deferrals will be allowed under extraordinary circumstances and really under the discretion of Zoe and myself. It's MCIM's a cohort-based program, and we want everyone to go through this in lockstep. And people who defer their enrollment will need to wait for the following year, but to begin matriculation. But again, since we're limited to 25 places, we're really kind of carefully managing the admissions process. So you're welcome to apply for next year's program and just let us know. But we're not going to be awarding a lot of deferrals because of the structure of the program. So we're going to be admitting people really up to our limit of 25. We're not allowed to go over that. Are only managers allowed to participate? That's a question we got in the chat as well, and the answer is absolutely not. Is someone who's currently in an analyst or non-supervisory role eligible to participate? And the answer is yes. And in fact, this kind of program can be really helpful to you to move your career forward and by getting these management skills. We're looking to build a cadre of professionals with a diverse range of experiences who want to move into management or leadership roles. Do Stanford healthcare employees qualify for any reimbursement? We recommend discussing this with your HR representative. Certain staff are eligible for the educational assistance plan, which is kind of a modest contribution. And then we're still on the faculty side, we're talking with different departments right now about their programs. And on the staff side, here at Stanford, this is inside baseball, I still have to I've had some preliminary conversations with David Entwistle about this. But if you have specific opportunity, let Zoe or I know. We'd be happy to work with you on that. Are international students able to apply for this program? And the answer is yes. International students are welcome to apply. I think we've got applications in the first round from 5 different countries. Make sure you refer to the graduate admissions website to ensure your academic credentials meet the requirements here at Stanford. And again, the TOEFL test scores. And then Stanford requires all non-US citizens, a registered resident or permanent residents to obtain and maintain appropriate visa status. And we are eligible to work with our international office to help with that. What are the total approximate tuition fees for this program? The fees for the program are set by the university. I don't know if we've set the fees yet for next year. During all 4 quarters of the program, students will be taking 11 to 18 graduate units. So 4 quarters at a full load, we estimate will be $72,000. Stanford fees and miscellaneous expenses are not included in this estimate. And again, the Board of Trustees usually does sets tuition in the spring. MCiM is CME accredited, and physicians can consider using their CME funding towards the program costs. So this was an exciting addition that we've been working with the CME office here at Stanford. And as we said, some Stanford employees may be able to use STAP or tuition reimbursement funding towards MCiM. Stanford doesn't offer tuition discounts for internal Stanford employees or faculty or actually anybody. But financial aid is provided through the Stanford Graduate Financial Aid Office. And unfortunately, the aid's not available for international students. Stanford as a private institution does not offer different pricing for in-state versus out-of-state tuition. These are not our program rules, these are Stanford rules. What are the on-campus sessions like? Our on-campus sessions will be offered on alternating weekends with 6 sessions per quarter, 6 weekends per quarter that you're here. Sessions will run from 8 to 5, and so we'll have a little bit of a light breakfast and lunch and light snacks. We'll probably do a dinner once a month. And beyond your courses, so basically you'll have, so my class will run 2 hours and 15 minutes in the morning. I do cases, so we would probably do 2 cases in that time, or a case and a lecture. Then you'll have a break, and then the next faculty member come in and do their course. That course will probably split over lunch, and then you'll have a 3rd course in the afternoon. So, and that structure will be pretty similar on Saturday as well. And so it's going to be pretty intense days. They're pretty packed in, again, because you're doing all your coursework in 2 weekends. Beyond the courses, we plan to include guest speakers, lots of professional development opportunities during these sessions, and our focus on helping you early in the year understand what it's like. We'll be working with our group here, it's down there below, Bioscience Careers. So actually, I'll jump to the next question. How can MCiM aid my professional development and career pathway? Students will gain highly applicable competencies, besides the fact that you've got a master's degree from Stanford, really strong network of Stanford faculty and alumni. Students will be supported through the, for career services, through Stanford School of Medicine's Biosci Career Center. We've been working already with them over the last year to think about how they, their career offerings in terms of career support, career coaching, we work with our program, think about opportunities for students coming out of this class. So they'll help you with resume, they'll help you with networking, and we'll work collaboratively with them. So they're very excited about that, and they've been very successful. And obviously, given that they're sitting here at Stanford, they've got deep inroads here in the Valley. Post-graduation, Stanford continued to benefit as members of the Stanford alumni community, as well as the growing MCiM alumni community. Due to the COVID pandemic, do you plan on hosting all the classes online? At this time, we don't know what the university regulations will be. Our students were going to come back in January, the freshman and sophomore class, and they've been put off until the spring. We're hoping, and well, I should say right now we're planning for in-person classes in the summer of 2021. It's really going to depend on Stanford University and how the pandemic is doing here and the vaccine rollout. We remain very positive we'll be able to provide the program in its intended format for all 4 quarters. However, if there's a question about safety and or ability to hold in-person classes, then we might have to start online and shift to in-person. But at least where things look right now, we should be fine by June. If not for semester 1, we definitely should be out of the woods, according to Tony Fauci. by Q2. So we have, right now we're planning for in-person, and we're hoping to do in-person, and we'll just see how things go. Next slide. All right, those were all the submitted questions in advance. Happy to take any other questions that people might have. Like I said, we're incredibly excited about this program. We've gotten really a great reception through round one. Zoe and I have started to look through with the admissions committee some of the applicants to the program. Incredibly strong and diverse cohort already being built. And we're excited to really, I think this first year, this first cohort is going to be an amazing group of people, really lots of different amazing backgrounds and experiences to bring to the classroom. And we're very excited about the opportunities that are going to be in front of people who graduate from this program.
Yeah, and if individuals want to send some questions to me in the chat box, I can pitch them to Kevin since we still have a few minutes left. There's a few that have already been submitted that I will ask Kevin now just because I think they are really relevant. So Kevin, someone is asking if the practicum and other courses will help people who are interested in startups or entrepreneurship, and what type of support there is through MCiM.
Yeah, so I think that's a great question. So if you come in with an idea, which a couple of people have done over the years, you can think about, how do I build my academic program to support my idea? There's no reason why you can't start the practicum project in your term one, or you use the biodesign class to try and refine your business skill, your business idea, and then start the practicum in term two. But that, writing a business plan for your new co is perfectly fine for a practicum project. My class, like I said, people have to write an app, a business plan for a killer app. So you're also more than welcome to start with that and see that through in terms of the practicum project. Just the class I teach in the daytime here at Stanford at the business school, two of my former students from, I guess, a year ago now, actually wrote an amazing paper for class. And at the end, we were looking at a certain digital platform. They really worked hard on it all semester and came back with a recommendation. Their final recommendation was that they should not go forward with the project that they had spent all this time on. And I think that was the right decision. But they really liked working with each other. And so they went out, they continued, they did a nice pivot, moved from what they're working on to the mental health space, and just raised $2 million through angel and A-round funding for their startup ideas. So I think this is a really nice program. I've had a couple of people, just again from my daytime class, go into other entrepreneurship programs here at Stanford, like Startup Garage. But for this program, you'd be building that through the practicum.
And here's a question that I can take. Someone's asking if they have a bachelor's degree from a foreign country, how does that work? So depending on what type of degree and where you earned your degree from, there is a page on the Stanford Graduate Admissions website that matches the foreign degree equivalency to the US version of the bachelor degree to make sure that you meet the minimum requirements. There should be a link to that on our MCiM application page. However, you could Google search it, or if you can't find it, send me an email at mciminquiry@stanford.edu, and I'm happy to share the web link. Here's another question for Kevin. Are there any prerequisites for this program?
Like I said, they're not. And I've been doing this for a long time. The faculty are assuming that you don't have a background other than some basic math. You're not supposed to have any programming skills. You're not supposed to have accounting skills. You're not supposed to, you're supposed to have some kind of experience that really distinguishes you from other people in the classroom, but there are really no prereqs for any of the courses. And the courses are designed that way. The courses are taught from a marketing perspective. So you're going to be in with a professor who teaches a really intense data science class, but you're not going to get the homework assignments that the engineers get. So, it's been, again, it's if you haven't been in school for a while, coming back to school is always an issue. Not an issue, it's just an experience to get back into the regime. Zoe is also going through that right now, so she can help you with that and commiserate about how to get back into the groove. And then, all of us here as faculty are here to work with you. And if there's something that's a real gap in your preparation, then we'll have to, sit with you and think about what you could do to remediate that while you're in the program. Our purpose in terms of looking at your background and applications is to make sure that you have an opportunity to be successful in this program. And we're pretty confident the people we select, even if you haven't done any of the technology or you haven't done any of the business, will be able to succeed in the program.
We have a question asking, what kind of experience would you recommend for someone who perhaps is just out of medical school or undergraduate program? And would you recommend applying with little experience in the field or maybe waiting to apply to the program later?
It really depends on what your what your individual kind of career goals are. If you're not sure where things stand, then I would get a year or two of experience under your belt and then come back. Like I said, this is a permanent degree program here at Stanford. If you don't think you can get a job because your background was an English major and you want to move into health, IT, and tech, and then that's that's a reason that where a program like this can be really helpful. So it's hard to talk in generalities. There are plenty of circumstances where getting a job first is the right answer, and there are other circumstances where going back to school is the right answer to accelerate your careers. If you have specific questions, you can walk through with Zoe or I after this, a different time to see what would be right.
And since you were just talking about career changers or people who are looking to, shift into this space, can you provide some thoughts or examples around career paths for students based off of the skills gathered from our curriculum?
Yeah, that's a great question, Zoe. I mean, it depends. If you start with a clinical background and you're a full-time clinician, this gives you skills to move into quality management, technology, all kinds of leadership opportunities. If you're, we've had a lot of people in the past that were in technology, but not in life sciences. We've had people that were in consulting, but not in healthcare. And again, healthcare is 20% of the US economy. Technology is kind of our future. And so there are lots of opportunities now and emerging for opportunities to apply your skills to a new field or develop new skills and move your career forward. So, some really interesting ones, again, were people that one of our nurses at Duke when I was there is now in outcomes research at Pfizer. We had a lot of people that went to data companies like Quintiles. We had a lot of people that went to consulting firms, and obviously a lot of people that went to healthcare systems. And then a lesser number in North Carolina, I think it's going to be a bigger number here, that started something new. One of the cases I teach in my class is actually a group of former students who started a company called Savannah Informatics in Nairobi that's now up to 60 employees. And it's always great. We have them Skype into class to talk about where they are. And so as you know, part of this depends on where you see your career going. But you know, I can't be more excited about the opportunities at the intersection of technology, healthcare, and business.
And we have a question here asking to talk a little bit more about the support / mentorship available to our students.
Yeah, so I think we've supported, we have, so first off, we have each of people in the classroom that are going to be there with their own skills and experiences, and some of these people have really pretty deep backgrounds. In terms of career placement, we have the Bioscience Career Office that's going to work with us as you move forward. Zoe and I have been putting together a network of mentors that we've recruited specifically to help with you understand careers and career pathways and career advice. So you'll have an opportunity. There's 50 different mentors that we've recruited from across all kinds of different backgrounds in healthcare to help you make decisions about your career. And then depending on what you're working on, one of the faculty might be an expert resource to you. Nigam Shah, who does data sciences, has started 2 companies in the last couple of years here at Stanford. I'm in the middle of trying to start the startup out of here, but I actually worked with an MCI grad for a startup that we exited back in North Carolina. Lots of really interesting faculty that could be of resource to you depending on what you're trying to do.
Okay, and then we have 2 more questions. I know we're running late on time. There's a question to continue just this discussion around potential applications of the program, specifically for people who are non-clinicians or non-IT professionals. So people who more are of a administrative background, or perhaps a career changer who has no experience in those areas.
Yeah, so I think, like I said, healthcare is a really interesting field. It's a really challenging field, a very rewarding field. You know, technology, I don't know how many hundreds of people we have in information technology here at Stanford. Actually, we even have people working for us here at Stanford that are graduates of my program from Duke. You know, so that's just one set of examples of opportunities people face. You know, One Medical just went public as an IT company. Livongo was a diabetes disease management company here in Mountain View that's now got bought by Teladoc, and really big questions here about technology and the use of technology. All of these companies have people in managerial and administrative roles, marketing roles that are non-clinicians.
All right, and then the last question is, can you talk more about your case studies? Someone thought the hospitals in Uganda and Nepal that you were talking about are very interesting, and they want to know what other type of case studies they may come across.
Yeah, so that one, we start with the cataract surgery in Aravind Eye Hospital and Tilganga Eye Hospital in Kathmandu. And these are literally, Reggie Hertzinger at Harvard called the term focus factories. These are organizations that are really designed to optimize throughput of patients get a specific procedure in those cases, cataract surgery. Really high volumes. We did a TDAVC study of why are they so efficient? We've done this with heart hospitals in India as well. Some of the other international studies that actually I use in my class, I talked about one, Savannah Informatics. These are students that actually there was all the transactions between hospitals and insurance companies in Nairobi were on paper. And they built a digital back end between the hospitals and insurance companies, and then now are using that platform actually for disease management with employers. And another really interesting technology development is, again, from Nairobi. There's a company, foundation called Farm Access in Amsterdam that worked with M-Pesa, which is this mobile wallet program that's available in Kenya to create something called Intiba, which is a mobile health wallet. And this is now available to people in the slums of Kenya, where you can, as a relative, you can make a deposit of a certain amount of money into people's mobile health wallets, and they can only use that money for healthcare. So it's a really interesting way to provide resources either from relatives and friends and families, or interestingly enough, from things like NGOs, like the Dutch government's put money into these mobile health wallets because obviously if I gave money out to people in Nairobi, people wouldn't use it for healthcare. But if I put money in this mobile health wallet, it becomes accountable. And it's a really kind of very interesting strategy going forward. So all of these case studies, all the idea of all of this is to think about both innovation, how do we think about new business models and technology here in the United States, and reverse innovation. How do we see how people have done it in other markets, maybe without the constraints that we have in the US healthcare market, to give us a true north in terms of what might be possible in terms of innovating in the healthcare marketplace.
Great. Well, I think that just about wraps it up. I don't have any additional questions, and we are actually 4 minutes over. So I appreciate everyone's time this evening. I'll go ahead and put the QR code up again if anyone wants to sign up to our mailing list and keep in touch. Other than that, I thank you all. And if there are any questions that you want to ask that you have not had the opportunity to do tonight, please send me an email at mciminquiry@stanford.edu and I will respond.
Thanks everyone for joining us tonight, and good luck in this process. We're really excited about this program. It's really going to be an amazing experience, and if it's right for you, we hope you'll join us. Again, Zoe, the date for the closing round 2?
February 23rd.
Great. All right, thank you all. Have a good evening.